Oh, sick. Outer space uh-ohs, outrageous alien injuries, and freaking laser beams.
Freaking laser beams!
Today, we're reacting to all of the medical scenes and wild injuries from the survival horror video game, Dead Space 2. Let's dive right in. Anything in the mouth bleeds a ton. If somebody's tongue is cut off and it's bleeding everywhere, you need a specialist like an oral maxillofacial surgeon or a plastic surgeon to be able to help. If your tooth comes up, balls out, you bleed a ton. You have your major blood vessels running next to your neck here, but on the inside of your mouth, it can actually get lacerated. It's behind your tonsils. Super dangerous if something gets punctured back there, so it can bleed a ton as well. Oh! Holy cow, the amount of strength it would take to not only impale, but then to rip a body in half is beyond what I can comprehend for a human being. Usually it's a mechanical issue or gravity issue. They get ripped in half because of a car accident, but not from necromorphs that are just ripping you apart. Holy cow. Like, run. So I know in the first game, to kill the necromorph, you got to chop off like the limbs. So I'm assuming that's similar in this game, but with cooler weapons because they're bigger, so you got to use, bigger weapons.
You're gonna need a bigger boat.
It's really cool. The suit that they're wearing, the light is basically on the vertebrae in the back. Not sure if it's connected to it or not, but it just looks pretty impressive. Getting shot up in the legs. Literally, we see people come to the emergency department where they have lacerations or crush injuries to their legs. The biggest thing that we worry about is the blood vessels. If they're bleeding, that's your first thing to try to fix. Sometimes if it's uncontrolled bleeding in the pre-hospital setting, somebody will actually put on a tourniquet. Oh no, the eyeball. I remember seeing the eyeball scene in the first one. What? This is actually correct. There's a specific type of lid retractor for your eyelids to keep them open. It's really hard to keep your eye from moving. A lot of times when somebody's having eye surgery, you'll have an anxiolytic like Ativan or Xanax or Valium to basically calm you down and try not to move the eye. Oh! Come on! Come on! So you have the bone on the backside of the eye itself. That's where your blood vessels and your muscles and your optic nerve, everything kind of rolls through in that area. It is darker blood, which is most likely venous blood. So we look at our arms and we see like the blue veins, right? It's not blue. The darker blood is more deoxygenated blood. Oh, sick! What? Whoa, we got like a spear gun.
Where's my spear gun?
Going up through the left upper shoulder area, through the chest. If you hit the shoulder, there's bone, right? If you hit the left upper chest, you worry about the lung, and you actually worry about major blood vessels coming off of your aorta, so your subclavian artery right underneath your rib here. Sometimes we'll actually go into those for a central line. So you're at risk of puncturing a major artery right there. Oh! What are these things? Those are nasty. Got shot in the neck just above the manubrium, basically where your clavicles are. You're worried about trachea, esophagus. You're worried about major blood vessels. You're worried about the spine straight through the back. If you just sever the spine through one shot like that, there's no connection from the brain down to the body. Use some space weapon that just took off the head. Really hard to do. The neck is very vulnerable because of all the major structures that are there, but also it gives us the advantage of being able to rotate and move around easily. Surgery.
I'll cut you out of there. Is that a tissue laser? A plasma cutter?
Surgical tissue incision in progress. So plasma cutter. I don't have these in the emergency department. We just use scissors and knives. Sometimes we have cauterization, but only in sophisticated operating rooms do they have really cool high-tech stuff that I'm not privy to at the moment. Oh, there's a necromorph. Turn the lasers on the necromorph. Oh man, I don't think he's alive anymore.
He's dead, Jim.
Multiple puncture wounds to the lungs, the heart, maybe the abdomen. You're not gonna die right away unless you bleed out or the heart's just totally trashed. If you rupture through one of the ventricles, you can bleed out pretty fast. But if there is a hole, then you actually potentially fix it. Grab a staple gun, staple it shut, or grab big suture material and just sew that bad boy shut as fast as you can. Wait, what is this? We got, looks like an ice pick with maybe an eyeball on the end of it. Looks weird. What? Taking an ice pick or whatever it is, screwdriver to the side of the head. The bone is probably a couple millimeters thick there, maybe a little bit more. You got soft tissue, so could that actually happen? Yes, if you have enough force, and there was a lot of force with that. Straight into the brain there. You're worried about your temporal lobe as well as your parietal lobes, which is different parts of the brain. Uh-oh. Oh, flying through space and just smack into something. What we do for a living as emergency medicine doctors and trauma docs is bad car accidents where people literally hit a solid object. You can have something as simple as just muscle strains versus decapitations or crush injuries. The lacerations that we see, the tissue just pops open and explodes due to the pressure. If you're just out there and you're exposed to the environment of space, you have all these things you need to worry about and can mess with your breathing, your lungs, bad things happen, and it's not sustainable with life. Whoa, 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 whoa. That is the fastest evolution I've seen of a necromorph. Puncture wound straight through the forehead, right into the frontal cortex, and now we have maybe implanted some infection or genetic mutation. Do we have a pathogen that works that fast? Not crazy that fast. It needs to get past our defense systems first, our natural immune system. Hours versus like the split seconds. Cool.
Awesome! Cool!
All the muscles of the neck. So the outer layer just under your skin is called your platysmus, but then underneath that you have your scalenes, you have your sternocleidomastoid, you have a lot of different structures just hanging right there anteriorly. Obviously you have different muscles on the back side of your neck, but really cool. Oh, we got a syringe filled with something. It looks white. A white liquid that we typically use in the emergency department ends up being propofol. Propofol is something that we use for sedation. That is one long needle. The only time I ever use needles that long is for a central line, which is a big major IV in one of your major blood vessels, or like a spinal needle. Those things can be really long too, but they're typically pretty skinny. Oh, wow, that even just hurts my eye. That is straight into the brain. Can you actually survive that? Yeah, maybe. I've seen people and I've seen images of nails to the head where it hit specific area and didn't hit any major structures. Same thing here. You're gonna lose your eye. Is it sustainable with life? Maybe, but then whatever's injected in is now in your brain. This was intense. Similar premise to the first one, but much more intense. Graphics, really cool. I like the suits. I really enjoyed it. If you guys want me to do more clips from this game, please let me know in the comments, and definitely check out this playlist right here. Make sure you binge watch the whole thing. And as always, please subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.